Hello, and welcome to the Adoption and Fostering Journal podcast. In this episode, we're going to be introducing the October issue of Adoption and Fostering, Volume 49, Issue 3. I'm Vicky Walker, the production editor of the journal.
And I'm Dennis Golm, the editor-in-chief. Hello.
And as usual, we've got a really exciting issue that we're really keen to share with you and introduce to you now. So let's just get started. Why don't we talk, as we usually do, about your editorial first, Dennis, which is tied to Nicole Martin and colleagues' article, Parental Choices and Outcomes in Inter-Country Adoption. And your editorial title is What are the Reasons for Regretting Adoptive Parenthood? So how does that relate to the article in question? Should we talk about them both at the same time a little bit?
I guess on the one hand, obviously, adoptive or general parenthood regret is a taboo topic, right?
Yeah.
That is not often talked about publicly, but I think it's important to talk about these things because not talking doesn't make it go away. So
No.
um, so it's better to have a look at what can be done. I think generally the featured study, if you want to call it that,
Yeah.
looked at kind of predictors of adoptive parent. It's a word. I don't want to say um, how because it followed them. Well, it assessed adoptive parents before the match, right?
Yes.
Then kind of
Yeah.
a year after the child had been placed with them.
Right.
Um, and then it looked at whether any kind of factors predicted placement satisfaction, maybe is a word. So I found
Absolutely. Yes. Yeah.
the idea
Yeah,
to
because I think they asked about levels of satisfaction and regrets as well, a mixture. And I choices that they asked about beforehand were kind of things like ethnicity, country of origin, age, gender, special needs status, weren't they? So
yes.
they were asking for the kind of criteria that people put down when they're conducting and also undergoing, sorry, an inter-country adoption.
I guess a bit similar to, when prospective adopters sit down with the social worker and kind of
Yeah.
discuss these things in a similar fashion I guess with the difference is that for inter-country adoption there are often two pathways, and there one is a kind of a special needs pathway where people know the children have confirmed special needs, so it's a different pathway. So that's also why it's kind of important to talk about these things.
And
And
in the article, they find that the higher the number of criteria and the more specific the criteria, the more likely the greater the number of regrets.
yes, I think first of all, I think we should say that generally regret was low in this.
Yes.
Um, but yes, I guess if you flip it round, we could say the more open adopters were to a range
Yeah.
of children, the more the more satisfaction, less regret they
Yeah.
experienced, right?
And so in your editorial, you look at some other studies that have been conducted. One of them was in Poland, I think. Is that right?
So, so, um,
Um,
so, so regret is only part of the featured study, and one thing they come up with is, well, one thing they report on is kind of the prevalence of adoptive parenthood regret after inter-country adoption, and that number was about, I would say, 13% regretted the decision of having adopted at all, and kind of 10% regretted the adoption of the specific child they had been matched with. So if you go with 13%, for instance, so 10 to 13% is adoptive parent regret, and that sounds like a lot. So I wanted to look at other studies on parenthood regret in the general population
generally.
outside of adoption. Um,
Yes.
and this research is mostly led by a group in Poland who have published multiple studies on it. And by accident, actually, after I had written the editorial, I was at the European Conference on Developmental Psychology in Vilnius, end of August, and he was there, and there was a symposium on the topic, and I went to it, and we had a chat after. So yeah, it was very, very, very interesting symposium.
What's the name of that researcher?
Piotrowski,
Hmm. Mhm.
Professor Piotrowski in Poland. And I think he's forming an international research network on the topic of parenthood regret. And they also developed a measure of how to measure it. And things. So it's interesting. But I think if we put it, and there are not that many studies. I think there are a couple of qualitative studies, and I know that there, for instance, there was a subreddit on parenthood regret, and some people went along and actually did a thematic analysis across the subreddit, for instance. But the qualitative data sort of match on quite well to some of the quantitative data. And so there's one kind of German study on a sample of over 2,000 parents, and they kind of ask a single question: if I could decide again today, I would not want to have children. That was the statement, and kind of 20% agreed or somewhat agreed with the statement. If we limit it to the ones who fully agreed with it, then parenthood regret was around 8%. Two Polish studies, both over 1,000 participants, one bit more representative than the other in terms of demographics. And going by that, in one study in Poland was 13.6%, and in the other one was 10.7%. So
So, yeah, on average, not dissimilar to the findings of.
there's somewhere between 8 and 13.6%.
Yeah.
So, I think that doesn't seem to be that different than in the general
No, so
population.
general population. Yeah, yeah.
I feel there were some. I think the one key difference I found was that um, even though it was a small effect in this in the featured study, but less regret was reported if parents adopted via a special needs pathway, while in general population study, special needs of the children are factors that increase feelings of regret. So what I made of this was that if someone is pre-informed and kind of consciously makes a decision to adopt a child with special needs, they regret it less. So it might be the consciousness of the decision really. And I think they also had in the general population studies there was slightly lower regret for same-sex parents. And I
Mhm.
thought maybe this is also similar because if you can't kind of make a baby or the conventional way, then it's always a conscious decision to become parents. So maybe that
Mhm.
plays a role as well.
Mhm.
And I think that that topic is really unexplored in among adoptive parents. And this was for inter-country adoption, so this is a kind of subcategory of adoption, right? So
So they had 473, am I right with that figure?
I
Go
think yeah,
specific.
around that, yeah.
You have
So it's a
73
decent sample
participants.
size.
Really good, especially to be able to follow up with that number as well. But I think just brilliant kind of study actually to have honesty around sensitive topics that actually to be able to get honest answers from people is that can provide really interesting data.
Yeah, and I think the point is not talking, as I said earlier, not talking about it doesn't make it go away. So I think it's about kind of removing the stigma around it so that people actually dare to talk about it, and then maybe it can be addressed, right, in
Yeah, absolutely, because
the
then you can look at
process.
support. And regret doesn't relate to how much you love a child or how you care for them or how you behavior necessarily. It's a kind of emotion, isn't it?
Yeah, it's just so that basically that you're regretting the life you have now to the imagined life you think you would have had without.
Yes.
Um,
Yeah.
so, and they're different. So parenthood regret is specifically kind of regretting the decision of having become a parent, while
Mm,
parental regret or other things are more about specific things. So maybe it would be regretting the role of a mother or something, right? Um,
mm,
or regretting certain aspects of that life, while parenthood regret is indeed the kind of term for regretting having become a parent in the first
yeah.
place. So yeah, so I think this is important study, and I think we need some studies to look into that amongst adoptive parent, and it would be very interesting how much kind of stage one, stage two training actually impact that,
Mm,
because hopefully they should prepare parents well, but if they don't, then that's also indicators of what could be improved upon, maybe in terms of, well, not saying they generally don't, but if parenthood regret still happens to a certain degree, maybe this is something that could be addressed or could be worked on, or it might be something that could be picked up by post-adoption support. But then you need to give people the feeling that you can openly talk about it, right?
yeah.
But also,
Yeah.
it's hard to admitting it to your partner, right? Um,
Yeah. Yeah.
it's very hard, probably, admitting it to a social worker, given how um, long-winded and complicated the adoption process is, and having gone through this, and then you suddenly so you give it a read. It's worth it, I would say.
Definitely. Definitely. So shall we look at the rest of the issue?
Yes.
We, from Sol Hillman and colleagues from, they come from various places, but I think the research is based at the Anna Freud Centre in London. Um, Intergenerational transmission of attachment, a qualitative study on 8 adopted children. So lots of research comes from the Anna Freud Centre, which is really fantastic research, and from this group. And there's a lot of data that's kind of used in different ways. This one is the Story STEM Assessment Profile, I think I'm going to write SSAP, that was used with these 8 adopted children, late adopted, by which we mean beyond infancy, I suppose, don't we, Dennis? We say late
Yeah, I
adopted.
think it was even older than 4 years, maybe.
All right.
So
Yeah. And it's a qualitative study. So they basically, with the story assessment profile, they give the children the beginning of a story that they then finish, to put it in quite simplistic terms, and that could be used to look at their attachment representations. And they were specifically looking at children either securely or insecurely attached with their representations, who'd been placed with parents who were either secure or insecure, and the effect that that might have. And I think ultimately they found that the securely attached parent, if at least one of the parents was securely attached, that had kind of positive effects on the attachment representations of the children sort of going into adolescence, which is useful knowledge generally for the kind of, again, support that is offered post-adoption.
yeah, and then I guess we move a bit further afield for the next article.
Mhm.
And we had the pleasure, so we don't want to tell you too much about the article because we had the pleasure of recording a podcast episode with three of the authors,
We do,
which
yeah.
was lovely. Um, and it's a study by Mercy Aladek-Boye and colleagues. And the title is The Mental Health Status of Orphans and Vulnerable Children in Residential Institutions in a City in Southwest Nigeria. And it's an interesting podcast and a very interesting article, and it basically assesses mental health needs, which, as you can imagine, are high in this population, but also the support that's on offer, which is not as good as it could be. Obviously, it's not very good. Um, and also discussions around the role that nurses could play in the support, because yeah, because they play very I mean, generally, I think within the how did they phrase it? But they highlighted the role of nurses amongst kind of these alternative care settings, right? Or the potential
Yeah.
role where support could be provided to
Mm.
fill a gap. So yeah, we talked. I think we talked a long time because it was so interesting. Um, so just look out for the episode and listen to it.
Definitely, and there's lots of context provided on what the kind of environments are like, what the settings are like, what the generally how things work in these settings, how things work kind of culturally in Southwest Nigeria. So really interesting, and assessment of mental health is kind of key as well, isn't it? That's kind of really
And I think also what we mentioned, what I mentioned in editorial earlier, for instance, as well, is that within institutionalized children, that um, it doesn't mean they don't have living parents, right? So here they talk about orphans who've
yeah.
lost both parents or one parent, but they also talk about social orphans, which have who have living parents, basically, um,
Mm.
but still end up in institutionalized care. So yeah, so yeah, give it a listen, give it a read, whatever you prefer, maybe both, you know.
Yeah, both would work, wouldn't it? Would work well. Um, so then fostering disabled children in Greece, insights into foster mothers' experiences, motivations, challenges, and satisfaction. Margarita Zamtaki, I'm so sorry. I don't know if I've done that justice to that surname. But this was a study, really, as the title suggests, conducted in Greece with foster mothers, talking to them about why they'd chosen to foster disabled children, what they got out of it, and what their kind of worries and concerns were for the future, as well as their kind of current challenges that they were facing. It's a really interesting piece, isn't it, Dennis, with some unexpected edges to
Some
it.
unexpected findings. I think one unexpected topic was around neglect and abuse within institutions. So that's what they didn't expect. So yeah,
Yeah, I think like in the interview guide, it wasn't something that they were specifically kind of looking for from their participants to talk about. They didn't sort of actively seek information on those kind of contexts for the children where they've been living before they were fostered. I think often the foster mothers had volunteered in the residential institutions, or they'd had some kind of contact with them, and that had kind of led to fostering a particular child. Often they had an existing connection with a child that they'd kind of decided to continue by fostering them. And then we've got another article that's based on residential institutions, the last article.
I think we're staying in
Um,
the Mediterranean, right?
yeah, yeah. Oh, makes me think of the summer. Family partnering in practice, the role of caregivers, epistemological theories in their interaction with families, Marzia Saglietti and Christina Zuccamaglia. And again, I apologize for my pronunciation. Um, so there were three group homes in Rome, Italy, that it was really, really fascinating for us in our different kind of editorial roles to work with this one, wasn't it, Dennis? Because it's quite different to the usual article and the methodology that we're used to working with.
So this observation, so where people recorded dinner conversations, for instance, and analyzed them. So some behavioral observation in there. So
Yeah.
it's a very rich data set that they use. It's a slightly older data set, but very rich.
Mm.
They looked at the different types of institutions. So very, very interesting and a kind of, yeah, just different methodological approach from what the journal usually publishes, maybe.
With the conclusions, really, that some of these resident group homes, these residential institutions, were not encouraging family partnering. They weren't encouraging family participation, and others were. So, kind of looking at that.
And then we have health notes.
Mm.
And I really like these health notes. It's health goal card. It's very because I mean I generally like our health notes, but these ones I like because they had things to share. that teach other people.
Images and resources, yes,
So the
yes.
health goal cards. So the title is Health Goal Cards, Empowering Children and Young People to Lead Their Healthcare Planning. And they developed this kind of cards almost as a conversation starter, maybe. So it's lots of different pictures from different situations, experiences that they have, and they have the words on them as well. Um, and I think my understanding was that often, or not often, but sometimes it can be that you are talking with a care experienced child and try to see whether there's an important topic, but nothing comes up. And these cards can kind of help kind of start the conversation, but maybe be stimulating in terms of what topics could be talked about, so the young person can kind of look through and think, oh, actually, this happened, and then talk about it, and then suddenly you have a conversation going. And the very nice thing is that they're sharing the cards, and you can download them with the link provided in the article.
There's a QR code as well as a URL, which is very fancy. They can be used as a kind of complementary tool or resource with the forms that we provide at Core and Bath, the initial health assessment and other health assessment forms. And yeah, just a fantastic resource and really nice to share that good practice and something that can set an example that other NH trusts could use, or other people doing these health assessments. That kind of empowerment of children. Obviously, it says that they don't always work, they're not right for every child, but being able to use tools that can help to empower children and young people to talk about their health and their situations is just such a good thing. So just to mention, we've got legal notes on England and Wales and Northern Ireland in the issue as well, and a book review. The book review is on a really tricky topic because it's on child sexual abuse in fostering, kinship care, special guardianship and adoption, and learning from Safeguarding Reviews 2007 to 2022. And there's a companion guide for professionals protecting, looked after and adopted children from sexual abuse in care, a guide for professionals by Hedy Cleaver and Wendy Rose. And Camelia Chowdhury Allen has reviewed both books for us. With the conclusion that they're extremely important and that they should be read really at every level of social work, just kind of as a reminder to think the unthinkable and remember that these situations of abuse do happen, and so practically what to do about it. So really, really worth reading the review, and the books are available on the Core and Bath bookshop.
I feel like we're not ending on a high here.
No, it's a really, really, it's such an important topic, but it's
Yeah.
a really tricky topic.
I mean, it's very well, incredibly important, because that's the thing that needs to be prevented at all costs, right? And that all the assessments done during adoption process try to prevent all the
Absolutely.
guardianship and other evaluation processes.
Mm.
Yeah, so very, very, very well, very important. And I'll have a read of the book review,
Yeah.
and hopefully we're coming back with more podcasting.
And of course, there's our back catalogue, which is growing, of podcasts. You can delve into all the podcasts we've recorded with our author interviews and introductions to the issues. So always
I feel
have a
like
listen to
we're
that.
approaching episode 20.
We're getting close, aren't we? Yeah. We'll have to have a celebration.
So, yeah,
I don't know what it'll involve.
there will be cheering.
Cheering. We can promise cheering. Yeah.
So yeah, so thank you very much for tuning in. Is that still what the young people say? I don't know. I don't think so.
Oh, we can't pretend to be the young people, can we?
No, I don't think
But yeah, thanks for tuning in. Absolutely. And see you next time.
so. Bye.